So the first commandment is attitude. Things work out best for those who make the best of how things work out, as said by John Wooden. So positive and healthy attitude matters and not the place. Whether you are in a rural setup or a city setup, attitude matters. Be loyal, hardworking, passionate and sincere to your work, and it always pays you surely. Be kind and social. Respect your colleagues. You may need their help anytime. Second commandment is vision. Nowadays NABH is coming, we have to propagate your mission and vision. So vision is take up one idea, make that one idea your life, think of it, dream of it, live on that idea, let the brain, muscle, nerves, every part of your body be full of that idea, and just leave every other idea alone, and this is the way to success, as said by Swami Vivekananda ji. Third commandment is growth. You should not be stagnant. You should conduct awareness camps, make the people literate, regular health checkup camps, bone density camps, formation of various clubs, engaging people, training your staff, as Chandrasekhar already said. Do charity also, affiliate to charitable trusts, because initially this helps a lot to get more and more patients. These are the camps. We have started Fulton Knee Club because Sanchiti sir had already started Sanchiti Knee Club since many years back. Taking that inspiration, I have started Fulton Knee Club since last 5 years, and we are conducting very big programs for that. Then fourth commandment is upgrade yourself. You should be jack of alls and master of most. Attending workshops and conferences is very mandatory. Try to learn and master new techniques. Dr. Wolfram Klu from Germany had visited my hospital. We did 3-4 joint replacements with him. Then I had been to Singapore General Hospital for a week to master the computer navigation skills. This is Dr. Yo. We have been using airspace suits. The fifth commandment is use of technology. Technology always pays, improve your results and builds your confidence. MRI, computer navigation, modular operation theatre, these are the technologies. I will just rush. The sixth commandment is involvement of the patients. Formation of various clubs, give them homely atmosphere, arrange various programs. So these are all knee replaced patients, old patients. We gather them on the 12th October, which is a World Arthritis Day, and we arrange a walkathon for this patient. And this was a very good event. Around 700 patients walked in and around Fulton, and it was a really good event. Last year, we organized a special event for females. This was the opening of the knee club. All these 3 patients have been operated by me, and they are total knee replacement patients. The 7th commandment is teamwork. Teamwork is the real key to success. You should have a very good team of doctors and anesthetists, and that pays you definitely, because individually you cannot do anything. Team has to be very perfect and skilled. Nurture your patients. We have been following a protocol that these are 2 sisters which got operated for total knee replacement on the same day, and they were discharged on the same day. At the time of going home, we celebrated their operation by cutting a cake, and we have made a protocol that every important patient or every major operation has been cutting a cake and celebrate them, and then we call every year and again cut a cake and celebrate their birthday of the operation. So patient become your brand ambassadors. We don't have to tell to anybody that please bring our patient. Then this is a 85-year-old patient operated by me. Give a rose, just give a tap, humanly touch. Then the most important commandment is know your limits, because you are in a small setup, you are in a rural practice, you don't have that much expertise. No heroic things, untoward incidents, negative impact, bad news spreads very fast. Good news may not spread that fast, but bad news spreads very fast, and that is a negative impact. Then the 10th commandment, important commandment, is be social. You should involve social people and take some programs for them. I have taken this program for all the lawyers in Fulton. Then I have been cycling. This is Shri Vishwasrao Nangre Patil. Most of you must be knowing IG Kolhapur. And I have a great opportunity with him to cycle for 60 kilometers from Fulton to Malshiras. Then this was an awareness program which I took for the Sakar Karkhana people at their place in Someshwar. Then this last year, Sindhute Sapkal visited our hospital and we took a big program for females. This year, we celebrated 12th October World Athletics Day with Vishwasrao Angre Patil and Amol Kolle, the Sambhaji actor. And I am very happy to say that 2,000 patients gathered for this gathering, and it was a really a good function. So the key to success is go step by step, never try to jump. Planning, determination, execution of goals is important, and then sky is the limit. So again, Mahatma Gandhi has said, 7 deadly sins you should prevent: wealth without work, pleasure without conscience, science without humanity, knowledge without character, politics without principle, commerce without morality, and worship without sacrifice. Thank you.